Let's react to this video by Ced Thompson. It's called Turkey vs. USA Hair Transplant.
So I got a hair transplant in Turkey, and I wanted to document the entire process because I feel like nobody does this well. And I'm gonna show you everything that you want to know. The injections and the sedation. Does it hurt? Damn! Will you be taken care of in Turkey? What the hotel is like, what the food is like, what the people are like, what the travel is like, from the airport to the procedure to the post-op care to getting back home. I documented all of it. And I think the biggest question is it worth it to go to Turkey over staying in the US to get your hair transplant? All right, so if you don't know me, my name is Ced. I'm a former NFL player who started losing his hair in the NFL. I remember my hair started to thin when I was with the New England Patriots. It's constantly taking your helmet on and off. You always touch your hair, and I noticed in the middle that my hair was starting to thin. Thought it was no big deal. As the years went on, I started to notice, oh, my hair is actually getting really thin.
Yeah, you see, that's the time to start on preventative medical therapy. And oftentimes people just wait too long. And by the time they get on finasteride, it's just a little too late.
Back then, hair transplants were going on, but you didn't really hear much about it. And I didn't think about it because I always thought, man, if I lose my hair, I'm gonna just go bald. Like, it's not that big of a deal. But then as the years went on, I realized that, oh, these things are actually really good and the results are there and maybe I'll do it. I kept using different products thinking that I was gonna be able to skip over hair transplant.
So here he has finasteride at 5 milligrams, but he's taking a quarter of a tablet. And that's, again, to protect what you have left. So the hair that's already been lost, it's mostly gone. Oral minoxidil would be a good thing to add to his regimen for boosting the existing hair. And then he's using this low-level laser light therapy, which is okay, but usually not as strong at stimulating the existing hair compared to oral minoxidil. And then he has ketoconazole shampoo at 2%, which again is okay for some anti-inflammatory, antifungal properties, but usually doesn't do a whole lot when it comes to regrowing your hair.
But all roads ended up leading to me getting a hair transplant. I reached out to them and let them know that I wanted to do a hair transplant.
So she's just, I'm translating right now.
And if I can go out there and document the whole thing to show the process, I ended up booking a trip and headed out to clinic.
Yeah, one of the things that Matt Dominance and I talked about in our podcast was that for some of these clinics that cater to, some better known people, let's say in the United States, they'll usually give you the A team, but then when someone else goes out to that same clinic, they might not get the same treatment. And that's kind of a sad reality of how some of the clinics operate, especially the ones that are more like hair mills and not necessarily giving each person the attention that they deserve, no matter what their status is in society.
So when you first get there, you have to fill out some paperwork, and this paperwork has all the basic questions. What medication are you on? Did you have any past surgeries? Are you allergic to any medication? And while you're filling it out, they're passing out smoothies and water and refreshments to make sure that you feel good before the procedure. Another question that they ask you is, when was the last time you ate? Because depending on how far you ate from the procedure determines if you can get sedated or not. And I wasn't getting sedated, Ricardo wasn't getting sedated, and Josh wasn't getting sedated.
It's generally better to get most of this information way in advance. So knowing what someone's medical history is like is very critical to see if you need any medical clearances. I don't think they're necessarily calling cardiology that same morning for clearance, right? So finding out some pre-existing history when it comes to, someone's medical health, I think is really important to see if they are on blood thinners, for example, and should have stopped it a few days ago rather than just doing it the day of. Also, as far as not eating, well, if you're going to sedate someone and you want to give them that option, that's something that again should be discussed way in advance so that if you need to keep them NPO after midnight the night before, then you're not giving them smoothies, the day that they're there for their procedure. That's just my 2 cents on how some of this is done.
Homeboys who actually came with me to also get a hair transplant, we all have very different hairlines and hair loss. It was going to be interesting to see who was going to have to get what.
So looking at Ced specifically, there's quite a bit of thinning throughout that whole central corridor, starting with the frontal scalp and then going all the way back to the mid-scalp and crown. You can see his friend Ricardo has primarily a crown loss pattern, and then Josh just has a more aggressive recession at the hairline. We don't really see his crown in this picture.
It's going to be interesting to see who was going to have to get what, how many grafts we were going to have to get, and all these things. But Ricardo and Josh came with me, and that made it even cooler. So while we were sitting there, Josh and Ricardo were called before me. They were sending me pictures of what the process was like and what was going on with them. But sure enough, it was my time. They walked me over to the elevator. We went upstairs, and then that's when the whole thing started.
Good morning.
Good morning. Nice to meet you.
Me too, thank you. Here it is. Ameliyat gerçekleştirmiş, bunu öğrenmek isterim. Herhangi bir alerji, kullanılan ilaç beslendirip saçlandırmak beyefendiyi.
So the doctor is saying the donor area is kind of small right now, according to the gap that needs to be filled up. Higher the line is, the more area we can fill up with the grafts we get from the donor area.
Okay.
You will be updated about the amount of graft we get from the donor area throughout the process, and then we will get to talk about like another plan again. Yeah.
Okay.
Lazerle ölçümümü yapıyorum, yapamıyorum. Işık kapatır mısınız?
A plan like according to the grafts we get from the donor area.
Okay.
So the donor area is kind of thin, and that's like genetic.
And I wonder if they had him start on medical therapy before even getting into the surgical process, because ideally you want to not just protect what you have left, but also solidify the hair so that when you get a transplant and there's some shock loss, you don't want the actual surgery, like the trauma of surgery, to cause your hair to fall out even more and then not return, right? That's kind of shock loss that can sometimes be permanent if you're not on the proper medical therapy. So again, stabilizing before surgery is really critical. So I wonder if they had him do that.
So I had a thin donor area and I had thinning on the top of my head. So the plan was for me to get as many grafts as I can from my donor area, and I had to sign off that I'm giving them permission to do that.
Again, this is where the discussion comes up of like, should you take out as many grafts as possible in one session, or should you map that out gradually over time so that you have some additional material to come back to should you want any additional changes? You know, it's like in football, are they throwing Hail Marys every single play? No, because it's higher risk. And that's the way I approach hair transplant surgery. But for some people, they rather just, throw everything in and hope for the best. And the problem is you have very few opportunities to make any adjustments afterwards if you aren't happy with the actual outcome. One thing I like is that I feel like they kept the hairline a little bit higher here, accounting for the fact that his donor supply was limited. And I think that was overall a good move.
I made sure that they're not going to rip me to shreds. They're going to just do what they need to do to give me the best results. If I'm flying all the way out here, I might as well give it the best shot. And they're professionals, and I have to just trust that they know what they're doing. There was also talks of a second procedure, which I was not excited about when we were sitting there talking. We would have to see how many grafts we would get when going to do the procedure. We came up with a plan to get as many grafts as we can.
Nobody ever wants a second procedure, but sometimes that's the most prudent way to do hair transplant surgery. So you see the results you got from the first surgery, and you can make adjustments and corrections going into the second. That, to me, is a more measured, appropriate approach in most cases compared to these Hail Mary attempts. And it seems like they wanted to have that conversation with him, but he wasn't too interested in it. The areas, by the way, here that they've marked out, there's zone number 1 and then I think zone number 2, and they've basically outlined the frontal scalp as zone 1 and then mid-scalp crown as zone 2. Each of those areas can easily take 3, 4, 5,000 grafts and still not get him to his original density. So I think that's something really important to highlight here. I would have probably stuck to about 2,000 grafts into zone 1 for his first surgery, but we'll see what they did here.
To see what the next steps would be once we get the grafts, I signed off on that, and then we were off to the races. Move fast.
Yeah.
Damn.
It's always fast.
Yeah. Ooh, man. I'm about to do like numbing.
Not numbing yet. Like shaving first.
Oh, so shaving first?
Just for long of the test.
Okay. And they hook you up to an IV. They also take some vials of blood to make sure that you pass all the tests, to make sure you don't have HIV and stuff like that. And once that's clear, that's when you start.
The piece about HIV, so HIV in and of itself is not a contraindication to elective cosmetic surgery. It's important to know what the CD4 levels are. It's important to know what the viral titers are going into a hair transplant surgery. But just because someone has HIV or a history of HIV doesn't make them not a candidate for surgery. But this again highlights the need for proper preoperative planning so you can optimize the flow of the day of surgery and not realize day of surgery that, hey, this person has something in their blood that now means we can't proceed with the case. So I don't know if that's where they were charging the shaver, but why is it on the floor? Not sure.
So when they shave your head, they also draw the final hairline with a pen instead of the white chalk that they originally used. And then you go back into the procedure room and then you start the numbing process.
We'll start the shot.
Damn! I'm not getting any sedation. I want the full experience to see how it actually feels. Damn, I'm getting nervous.
Yeah, we give Ambien and Valium with our hair transplants. We don't typically give an IV with full sedation. That's a very rare thing for us to do. And here you see that they're going to start with the harvest first. I usually like to start with the site making first. That then informs, how many grafts we need when we go to the donor area.
So if you don't know, this is how it goes. They're taking grafts from the sides of your head and the back of your head. That's called the donor area. And they're going to take those hairs and put them in where you need hair.
The reason is that those are hairs that are DHT resistant for the most part. Remember, with FUE surgery, the harvest is fairly broad. So some areas that you go into might still have some DHT sensitivity. So again, it's important to be on medical therapy, not just to protect the existing hair in the central zone that's DHT sensitive for the most part. It's also important to keep that donor hair as robust as possible with medical therapy. Again, finasteride, minoxidil are the two most commonly used in my practice, and most of my patients are getting it from feelconfident.com.
And the technicians did a great job, because when I laid down, they asked me, was I ready? I said, yeah. They said, take a deep breath, exhale. And when I exhaled, they started the shot, and then we were off to the races, getting the grafts to put in my thinning hair, which is called the recipient area.
So this part is actually the most dangerous part of the whole transplant surgery, because this is where you can get lidocaine toxicity. So it's important not to use too much lidocaine, or else your body can start to have some reactions to that. And some of those reactions can affect the heart, the brain, the way that everything works. And there have been instances of intraoperative death from too much lidocaine. So this part's critical.
There's something with the local anesthesia that people don't talk about that I think needs to be said, so you really know if you need to get sedated. But I want to focus on the procedure, and I'll talk about that at the end of the video. But the extraction started. So they have something called a motorized FUE gun. She's using the tool to push up the grafts so they're easily taken out by the second technician.
With afro curl, it's very important to follow that natural curvature. It's not a straight hair. So one needs to adjust the wrist position so you don't get transections of your grafts. And that's something that's unique to the afro curl. And I'm sure they were doing that in this case.
So once the first technician got to about right here with my head, the second technician sat right next to her and she starts pulling out the grafts with tweezers and putting them on her hand.
Putting them on your hand is okay, but you don't want the grafts to dry out. So keeping them as hydrated as possible is really critical for graft survival.
While she's collecting these grafts, also putting them on a dish with liquid so the grafts can stay alive. When they were going around doing this process, if I felt any pain at all I had to do was say, I feel something there. And they take local anesthesia and they put it right then and there, and like this, you don't feel anything. It's that quick. So this part took about 3 hours. And then when we were done, Dr. Ced came in to let me know how many grafts we got.
How are you?
Good, how are you?
I'm fine, thank you. Your grades number 4,100.
For 3 hours with afro hair, 4,100 is a lot of grafts. And it's important to highlight a few things here. A graft in one place is not necessarily equivalent to a graft in another place. At the end of the day, it's largely about the coefficient or the number of hairs per graft that are being transplanted. And I feel like oftentimes that gets missed in education about hair transplants, right? A lot of people don't understand that point. And they get lured in by some clinics promising these little tiny punches that will give you so many grafts. But if you think about it, it's really about the number of hairs that are transplanted at the end of the day, not grafts. So if, for example, we have mostly single hair grafts, right? Little smaller grafts that were obtained that way because the punch size used was small, right? That gives us the ability to get more grafts out of the scalp, but the number of hairs will be, let's say, about 4,000. Contrast that with a slightly bigger punch that will yield, let's say, on average more 2-hair grafts. And with 2-hair grafts, that will give you double the number of hairs per graft, right? So if you have 2,000 of those types of grafts, each coming in at least 2 hairs or 3 hairs, well, all of a sudden you are transplanting 4,000 hairs plus to the same area. So while the graft count might differ, the number of hairs, like what you're actually creating, is going to be more substantial, or at least equivalent to, right? But the clinic may have charged you for 4,000 grafts. They're not necessarily charging you for the number of hairs. And that's where people get confused. And so in my clinic, I'm not as fixated on driving up the graft count or making it look so impressive, because at the end of the day, it's like you just want to deliver a great outcome to the patient. Also, 4,100 grafts, even let's say they had robust grafts that were not these small transected ones, which I fear some of them may have been, but even if they were very robust grafts, that number is not going to be enough to create very dense packing in both of those large sections that they outlined. So again, it comes down to understanding the potential outcomes, and if he was okay with, some improvement but nothing, too dense, then covering such a large space was okay. But if instead he was hoping for some really solid density, then it may have been better to work in mostly into that first zone, the frontal scalp.
But there was a problem, even though she was happy with how many grafts we got.
Buraya homojen bir dağılım yapabilirim. Sakal isterse sakalı şimdi alabiliriz. Biraz daha desteklemiş olurum.
Do a full coverage with 4100. Planning would be a full density on this first part if you can open the mirror.
Okay.
Over here it's going to be full density, and on your crown it's going to be a bit more homogenic. Saying that if you want, we can do a graded extraction.
Yeah, but you see, having this discussion this far into the game when they've already taken all these grafts out is not a great idea, especially if he has some sedation on board. It's one thing if they discuss the possibility of a beard transplant before the day of surgery, but if this is just something that he's hearing about now, I don't think that's the fairest thing to spring on someone last minute. But, it is surgery after all, and maybe he was prepared for these different possibilities.
What she told me was, if we can get about 600 more grafts from my beard, then I don't have to have a second procedure.
But you see, that's not accurate either, because that extra 600 from the beard is not going to make that big of a difference as far as his crown density goes. That's a large, thin crown area. They're likely going to be investing at least 2,000 to 3,000 in the frontal scalp, which leaves them with maybe 1,000 from the scalp into the crown. And then even with 600 extras from the beard, it's still going to look kind of thin, and he's still going to likely want a second procedure. So again, I think it's just about giving people honest expectations.
I had a little lunch break and I had time to sit and process. All right, this is the first time I really gotten to sit down and talk, but she's recommending that I pull some from my beard, which is like my neck, to get full coverage on my crown. If I come back to Turkey for a second time, I don't want it to be for a transplant. I'd rather come back and just visit. So I'm gonna do the beard extraction and go for it. So I had lunch, was feeling good about the plan, and then we started the beard extraction. Now, I'm not gonna lie, I was more nervous about the beard extraction because I'm like, all right, I can handle my head, I think. Being on my face and under my neck, I'm like, I don't know how this is gonna feel. But again, it was not as bad as everybody makes it seem. It's quick, super precise. Again, if I felt any pain, I told them and they took care of it. So now we did the extractions from my head, we did the extractions from my beard, and we got a grand total of 4,700 grafts. 4,100 from my head is 600 from my beard. So Dr. Ced came in and she's making tiny slits in the bald and thinning areas where the new hairs will go.
You have to also keep in mind the amount of time that now these grafts have been out of the body. That's why I usually like to start with my site making first, because then there's less time that the grafts are out of the body. But here, when you calculate how much time the original scalp hairs that were moved have been sitting out, we're talking probably figure 4 or 5 hours easy, if not more. That might at some point play a role in graft survival, because now again, she was making all the sites. They're not using implanter pens from what I can tell. She has to make the sites, and then the team comes in and has to place the grafts.
These cuts decide the direction, the angle, and the density of my new hair. This took about a little less than an hour. Like Dr. Ced came in and her part was really quick. So she did her incisions, she left, and it was me and the 2 technicians again, and they started taking the grafts and putting them in the incisions.
That is, remember, the artistic part of the whole surgery. So it's not something that you want to rush. And if she was able to do a great job in that broad of an area in an hour, then, good on her. I find that it often takes a bit longer, especially when you have to pattern through multiple large areas of thinning.
They were using tweezers again, and they were also using like these special pins to put the grafts inside of the new incisions. This part was the longest of the entire procedure. It took about 4 hours and some change. During that 4 hours, I was able to watch TV. I was listening to music and podcasts on my AirPods. Me, Josh, and Ricardo were sending each other pictures, letting each other know what part of the procedure we were on.
Different things can lengthen the time of surgery. Sometimes grafts can be slippery. Sometimes there's popping, so a graft goes in and then some neighbors come out. All those things can lengthen surgical time. Sometimes there's additional bleeding. Sometimes patients, need a lot of breaks. Sometimes they're still in pain and they're hard to numb. And so, all these things can lengthen surgical time.
So now the big questions, was it worth it? My total grafts were $4,700. The price per graft was from 50 to 80 cents. The cost in Turkey will be anywhere from $2,500 to $4,000, which usually includes a hotel, a driver, and aftercare. Now the US equivalent, the price per graft is from $5 to $8. And many US clinics won't even do beard extractions unless you're with a top tier surgeon, which pushes the price even higher. So side by side, 4,700 grafts in Turkey is anywhere from $2,500 to $4,000. And then in the US, for 4,700 grafts, it will be around $25,000 to $40,000. So it's about 10 times more expensive in the US. And to keep it all the way real, that's really the biggest difference is the price. I think that if you find some place that has good surgeons, that is the most important thing, is finding someone who can do what it is that you're looking for. Find reviews and results from that clinic. And once you do that, you got to put it in the surgeon's and the clinic's hands. I think anybody who does poor research should expect questioning themselves after the procedure because of the lack of research that you do. I feel like Turkey is the capital to do this because they've been doing it for a long time. And they have hundreds of clinics for a reason because I think they have the technology and the expertise. But just because there's a bunch of clinics does not mean that every clinic is good.
What I agree with him on is that at the end of the day, it comes down to the surgeon and his or her own team. And that is what you should spend time selecting carefully. As far as, whether to go to the US or Turkey or anywhere else, there's great surgeons all over the place. And there's substandard surgeons all over the place. So, that part it's a lot less critical, kind of where you go. It's about finding that right surgeon. And then price point wise, of course, everyone's going to have a different budget, a different, place where they feel more comfortable when it comes to price and everything else. Some people want to stay close to home. Some people are, open to travel. Some people really want to travel for their surgical experience. So, I'm not here to tell you what's right, what's wrong, but I will say that it is about finding the right fit for you, and you want a place that you can trust, where you've seen work that you really like and would want something similar. And I think that's what it's more about. I don't think that the number one thing should be, trying to find the most budget place, but who am I to say? For some people, that really is the number one factor. So to each his own, but I appreciate Ced for walking us through his experience and being so open about his journey. I hope he's happy with his results. And that's all I got to say for now. Thanks.